if you're over 50 and have started noticing that you need to get up multiple times during the night to urinate, feel like your bladder never fully empties, or simply worry about your prostate health, you're not alone. These symptoms affect millions of men and are signals that your body is asking for attention. The first reaction many men have is to rush to the pharmacy and grab a zinc supplement. After all, everyone talks about how important this mineral is for prostate health, right? But here's the truth that few healthcare professionals share. Your body absorbs nutrients far more efficiently when they come from whole foods, not isolated capsules. My name is Dr. Isabel López, and I've been a urologist for over 15 years. Today, I'm going to share a simple, science-backed strategy with you: how 2 specific nuts, eaten daily at night, can become your allies in protecting and supporting prostate health. Get ready to discover that nature already provides what you need, without complications. Zinc is one of the most important minerals for male health. It plays an active role in testosterone production, a hormone that's fundamental not just for libido, but also for maintaining muscle mass, energy levels, and metabolic balance. Beyond that, zinc regulates prostate cell growth and helps prevent abnormal cellular proliferation. Research has consistently shown that zinc deficiency is associated with chronic prostatic inflammation and benign prostatic hyperplasia, BPH, the condition that causes prostate enlargement and those frustrating urinary symptoms. The prostate tissue actually contains higher concentrations of zinc than almost any other organ in the body, which tells us just how crucial this mineral is. However, here's where things get tricky. When you take zinc in supplement form, especially in high doses, your body may struggle to absorb it properly. Worse yet, excess zinc can interfere with copper absorption, creating a mineral imbalance that can lead to other health problems, including immune dysfunction and anemia. Synthetic supplements also lack the cofactors and complementary nutrients found in whole foods that enhance absorption and utilization. This is why getting your zinc from natural food sources is not just better, it's smarter. And that's exactly where our 2 powerful nuts come into the picture. While we're focusing on zinc, there's another mineral that deserves equal attention when it comes to prostate health: selenium. And Brazil nuts are nature's most concentrated source of this powerful antioxidant. Selenium plays a critical role in reducing oxidative stress in prostate cells. Oxidative stress occurs when free radicals damage cellular structures, leading to inflammation and potentially increasing cancer risk. The prostate is particularly vulnerable to oxidative damage, especially as men age. Multiple research studies have demonstrated that adequate selenium intake is associated with lower inflammatory markers in the prostate and may help prevent prostate cancer. A landmark study published in the Journal of the National Cancer Institute found that men with higher selenium levels had significantly reduced prostate cancer risk compared to those with lower levels. Here's what makes Brazil nuts so remarkable. Just 1 nut contains approximately 68 to 91 micrograms of selenium, which is close to the recommended daily intake of 55 micrograms for adult men. This means you don't need many. In fact, eating more than 2 Brazil nuts daily can lead to selenium toxicity, which can cause hair loss, nail brittleness, and digestive issues. The key is consistency, not quantity. 1 Brazil nut per day provides powerful antioxidant protection for your prostate without any risk of excess. While Brazil nuts deliver selenium, walnuts bring a completely different set of prostate protective compounds to the table. These wrinkly, brain-shaped nuts are packed with omega-3 fatty acids, particularly alpha-linolenic acid, ELA, which has potent anti-inflammatory properties. Chronic inflammation is one of the primary drivers of prostate enlargement and dysfunction. The omega-3 fats in walnuts help counteract this inflammatory process by regulating the production of inflammatory molecules called prostaglandins. This is particularly important for men dealing with BPH or chronic prostatitis. But that's not all. Walnuts also contain phytosterols, plant compounds that have a similar structure to cholesterol. These phytosterols help balance male hormones, particularly by influencing how the body converts testosterone to dihydrotestosterone, DHT, a more potent form that can stimulate excessive prostate growth when present in high levels. Research published in the British Journal of Nutrition found that regular walnut consumption is associated with improved endothelial function, the health of your blood vessel linings. This matters for prostate health because good blood flow ensures adequate oxygen and nutrient delivery to prostate tissue, supporting its proper function. A small handful of walnuts, about 7 to 8 whole nuts, or approximately 30 grams, provides the ideal amount of these beneficial fats without excessive calories. Eating them at night not only supports hormone balance, but also promotes satiety, which can help prevent unhealthy late-night snacking. You might wonder, does it really matter when I eat these nuts? The answer, according to chronobiology research, is yes. Timing can significantly impact how your body uses these nutrients. During the night, particularly during deep sleep, your body shifts into repair and regeneration mode. This is when growth hormone is released, cellular repair processes accelerate, and hormonal regulation occurs. Testosterone levels, for instance, typically peak during sleep and in the early morning hours. Consuming foods rich in healthy fats and essential minerals before bed provides your body with the raw materials it needs for these overnight processes. The fats in walnuts and Brazil nuts support the synthesis of hormones like testosterone, which are cholesterol-derived and require adequate fat intake for optimal production. Additionally, the combination of healthy fats, protein, and minerals in these nuts helps stabilize blood sugar levels throughout the night. This prevents the blood sugar spikes and crashes that can disrupt sleep and interfere with proper hormonal regulation. The magnesium content in both walnuts and Brazil nuts also supports relaxation and sleep quality by regulating neurotransmitters and the stress response. Better sleep means better hormonal balance, which directly translates to better prostate health. Creating a simple evening ritual of eating one Brazil nut and a small handful of walnuts about 30 to 60 minutes before bed can become a powerful habit that supports not just your prostate, but your overall metabolic and hormonal health. While these two nuts are powerful on their own, you can amplify their prostate protective benefits by incorporating other strategic foods and lifestyle habits into your routine. Cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, and kale contain compounds called indole, 3-carbinol, and sulforaphane. These phytonutrients support the liver's detoxification of excess estrogen and help maintain a healthy testosterone to estrogen ratio, which is crucial for prostate health. Aim for at least one serving of cruciferous vegetables daily. Tomatoes and tomato products are rich in lycopene, another powerful antioxidant specifically linked to prostate health. Lycopene is better absorbed when tomatoes are cooked and consumed with a bit of fat, so consider dishes like tomato sauce with olive oil. Green tea contains catechins, particularly epigallocatechin gallate, EGCG, which has shown promise in laboratory studies for inhibiting prostate cancer cell growth and reducing inflammation. On the flip side, certain foods and habits can undermine your efforts. Limit alcohol consumption, especially beer, which can increase estrogen levels and contribute to prostate inflammation. If you do drink, keep it moderate, no more than 1 to 2 drinks per day. Avoid processed foods, refined sugars, and trans fats, which promote systemic inflammation and can worsen prostate symptoms. These foods also contribute to insulin resistance, which is linked to higher BPH risk. Stay well hydrated throughout the day, but taper your fluid intake in the evening to minimize nighttime bathroom trips. Aim for most of your water consumption before 6 p.m. Proper hydration supports healthy urinary function and helps flush out inflammatory byproducts. Regular physical activity is also essential. Exercise improves blood flow, reduces inflammation, supports healthy hormone levels, and helps maintain a healthy weight. All factors that protect prostate health. Caring for your prostate isn't about finding a magic pill or the latest supplement trend. It's about nourishing your body intelligently with whole, nutrient-dense foods that work synergistically to support your health from the inside out. The beauty of this approach is its simplicity. One Brazil nut and a small handful of walnuts each evening. That's it. No complicated protocols, no expensive supplements with questionable absorption rates, no side effects. Just two powerful foods that nature designed perfectly to deliver the minerals, fats, and antioxidants your prostate needs to stay healthy. These small daily habits can make a profound difference over time. Combined with regular exercise, stress management, adequate sleep, and a diet rich in vegetables and whole foods, this simple nut ritual becomes part of a comprehensive strategy for maintaining prostate health well into your later years. Remember, prevention is the best medicine. Don't wait until symptoms become severe or until a diagnosis forces you to take action. Start now. Make your next grocery trip count by picking up some raw, unsalted Brazil nuts and walnuts. Store them in your refrigerator to keep them fresh and create that evening ritual tonight. And most importantly, don't neglect regular medical checkups. These dietary strategies are meant to complement, not replace, proper medical screening. Talk to your doctor about appropriate prostate screening based on your age, family history, and risk factors. Your prostate health is an investment in your quality of life, your independence, and your vitality as you age. Take control with simple, science-backed nutrition. Your body and your future self will thank you